Good evening, and I hope you're having a great Monday. The weather was nice here in the Houston area. So those of you who are in this area, I'm sure you had nice warm weather. I got out into the garden this weekend and did some, as I call it, guerrilla gardening or emergency gardening. I had some plants that I had to get into the garden real fast. And so I was hurrying and getting that done. So I had a productive weekend from the standpoint of gardening and other things that I got done. And of course, today started out a little bit chaotic. We had some plumbing issues at the office. But nevertheless, we're here for another wonderful show, The Fresh Natural Live. And we have a very special guest tonight who's going to educate us on the topic of homeopathic medicine. Many of you may not know what that is, but that's okay. Sit back and get your pen and paper ready. We're going to learn about what is homeopathic medicine and how it can benefit you. So sit back, get comfortable, and stay tuned. Hello again, and as I said, we're going to learn about homeopathic medicine. Our special guest tonight is a friend and colleague of mine, Dr. Sakita Shah. Dr. Shah is a highly experienced practitioner with more than 25 years of experience under the belt. She specializes in homeopathic medicine as well as acupuncture and Chinese herbal medicine, making her one of the few practitioners trained in both homeopathy and traditional Chinese medicine. She brings this training to the state of Texas, offering 3 different modalities: homeopathy, acupuncture, and Chinese herbal medicine in 3 different locations: Houston, Sugar Land, and Brenham, Texas. So I'm delighted to have Dr. Shah on the show tonight, and I have 1,000 questions. I hope you guys have questions for her tonight. But we're really going to learn about homeopathic medicine. I'm going to break this discussion into 3 parts. Part 1 is going to be, what is homeopathic medicine? Where did it come from? The basic background. Part 2 is who benefits from it. What are some of the areas of homeopathic medicine? And then part 3, I'm going to ask Dr. Shah to give us details about her practice and tell us about some of the patients that she's dealt with, to give us some insight into what a homeopathic physician does and how that can integrate or benefit each one of you. Hello, Catherine Welch and Get My Own. Good evening. I'm glad you guys are here early. So I'm going to bring my colleague and fellow panelist, Dr. Celeste Palmer. Dr. Palmer, how are you doing today?
I'm well.
Hope you had a good weekend and a good Monday. I have some plumbing stories to share with you later on, but we'll do that after the show. We've been talking plumbing over the last weeks, but anyway. But without further ado, I'm going to introduce our special guest tonight, Dr. Sakita Shah. Dr. Shah, how are you today?
I'm doing good. Thank you for having me.
Thanks for joining us. And, this is a topic that I really look forward to discussing, because oftentimes my patients are looking for, alternative approaches. We use nutrition and other things, and our patients are looking for ways outside of the Western medical therapies and ways of sort of helping the body heal itself. So I know a little bit about a homeopathic medicine, but I'm sure after tonight, I'm going to know much more. So I just want to get the conversation started. What is homeopathic medicine? If somebody just saw me in the elevator and said, well, what's homeopathic medicine? How can I break that down and kind of what's the overview of that?
So it's a system of medicine which originated in Germany in 1790. And the whole idea is to have a holistic approach where you are treating person as a whole, not just treating the organs or different parts of the body. And homeopathic medicines usually are made from natural substances like plants and minerals and some animal products.
Gotcha. So basically, with homeopathic medicine, are there any training centers here in the U.S. or what did you get your training in? And I mean, how did you come about learning about homeopathic medicine, getting into that field?
So I was trained in India, and usually with homeopathic medicine, the training varies from country to country. Like India has medical practitioners who are trained also in homeopathy. Same thing is true in Argentina, Mexico, Colombia. Whereas some other countries like France, Germany have certain practitioners who are trained specifically in homeopathy. And in United States, again, it varies. We don't have that many schools. Mainly it is taught in naturopathic. Any of the naturopathic schools tend to have homeopathy as one of the subjects.
So you mentioned nature, because I'm familiar with some naturopathic schools here, but that's not the same as a homeopathic school, or is it?
No. With homeopathic schools, like usually you go through training for 5 to 6 years. You also go through internship period. With naturopathic schools, they tend to have homeopathy as one of the subjects, along with other different nutritional supplements.
Gotcha. So that's much different than a 5 to 6 year training in it.
Yes.
And they train in a number of other things. I think they do a little bit of acupuncture and some other things as well.
That's true.
So it's naturopathic medicine, more of a survey, I guess, of different areas. As homeopathic gets right into the
Exactly.
Okay. Now, y'all deal with natural substances, herbs, and the things. I mean, because I know you have a specialty in Chinese herbal medicine. Did your homeopathic training give you any insight to that, or did you get separate training from the herbal?
No, it's a completely different, separate training, because with homeopathy, we tend to use more of Western herbs like echinacea, golden seal, arnica. So it tends to differ a little bit. There are some common herbs which are used in traditional Chinese medicine as well as in homeopathy. But the difference being homeopathy is based on principle of like cures like.
Gotcha.
So, and also they are highly diluted medicines. So that way also the preparation is very different from traditional Chinese medicine.
Gotcha. So, in the United States, and I've read a little bit about this, we weren't always in a situation where we practice pharmaceutical and device-driven medicine. There was a time that, doctors, I remember in medical school reading about doctors spending a year or semester in botany and doing things that were more along the lines of a natural, holistic approach. Was homeopathy part of that training in the United States, prior to the onset of Western medicine here?
Oh, yes, absolutely. And it's interesting, like there was a Danish physician, Hans Gram, who was from Boston. And he went to Denmark and got trained in homeopathy. And he found homeopathy so beneficial that after coming to United States, he started training other physicians in homeopathy. And around that time, there were almost, I think, 40 to 50 medical schools where they were also trained in homeopathy. And interestingly, two of the most well-known homeopathic practitioners are originally from United States. And I'm talking about in 19th century.
Wow. So Hans Gram he sort of got it kicked off here in the United States.
Yes, absolutely. Yes.
So what's the prevalence of homeopathic medicine here in the United States? I understand you're the only homeopathic physician in Texas. Is that correct?
Yes, I think there are some naturopathic physicians who have started practicing, but I'm not aware of anyone in Houston as such, because we also have Texas Society of Homeopathy, where we keep track of all the different practitioners of homeopathy in Texas area. And there is also National Center of Homeopathy, which has a directory of different practitioners all over the United States. But that includes everyone, like lay practitioner as well as professional practitioners.
Gotcha. So that's people who are not necessarily formally trained in homeopathy, yes, but they practice it to a certain amount, to a certain extent.
Yes.
So I didn't know there was a Texas Society of Homeopathy. So there must be more than a handful of homeopathic doctors here then.
Right. Yes.
So I guess you're the only one in the Houston area?
Yes.
Gotcha. Now, do you have colleagues that you confer to? Do you have conferences or things that you go to?
Yes.
Exchange ideas?
Absolutely. So we have annual conference in Texas Society of Homeopathy holds it, especially for practitioners from Texas area. So there are some practitioners in San Antonio, Dallas, Fort Worth, Houston area. And there are also national conferences which are held by National Center of Homeopathy, and there is also American Institute of Homeopathy. This was founded in 19th century, which was specifically for physicians who were trained in homeopathy or who are also interested in homeopathy. So they also have their own conferences. It's American Institute of Homeopathy.
Wow, fast. So would it be beneficial for someone like me to go to one of these conferences if I wanted to learn more about it?
Yes,
Okay.
absolutely.
Wow. I may have to curbside you on some of that.
Right.
Now, there's a question on here regarding breakthroughs of Catherine Welch. Catherine, we're going to address that in one of our later subjects. So my understanding is that, the Rockefellers and Rockefeller and Carnegie, I remember reading Rockefeller, donated money. I think it started with Hopkins, and, they had a plan where they started instituting, pharmaceutical drugs. They changed the nature of education in medical schools. I think Carnegie was part of that whole process, and they pushed it out. What's your understanding? Is that I guess it was purely economics and politics, which tend to
absolutely. Yeah, that's the unfortunate part. Yeah, it's absolutely political and economical, because homeopathic practitioners or the physicians who were also practicing homeopathy were doing extremely well, and they were seeing much better results, and more patients were seeking homeopathic treatment that time. And around the same time, the time frame you're talking about, American Medical Association decided to kind of go after them because they were losing patients, they were losing practice. So it was completely economically based. You're absolutely right. It was more of political and economical, where they decided that they should be kind of pushed aside, and American Medical Association was formed. Yes.
So the American Medical Association was formed as a result of the onset of Western medicine.
Yes.
So
yes.
Was there a homeopathic association, or how did the physicians associate themselves prior to the AMA?
Yeah, so there was Homeopathic Medical Association. So physicians who were trained in homeopathy, they formed their own association.
And did that precede the AMA?
Yes.
I have a quick question.
Yes.
For just how, okay, so we talked about the difference between naturopathic and homeopathic medicine. How about Ayurvedic medicine or Ayurvedic?
So Ayurvedic medicine is similar to traditional Chinese medicine.
Okay.
And Ayurvedic medicine is also thousands of years old. The principles are a little bit different because homeopathy is based only on like cures like, whereas Ayurvedic medicine is based on the 5-element theory, which is based on like mainly wind, fire, and flame.
Okay.
And the preparation of the herbs is very different.
Okay.
Than compared to homeopathy. Homeopathy doesn't have, for example, Ayurveda has also massage oil. They also have yogasan as a part of it, pranayam part of meditation, and they have different herbs. So that way it varies. It is a little bit different from homeopathy, where the preparation of the herbs and the principles are a little bit different from Ayurveda.
Okay. So that's another question I had. So with homeopathic medicine, you know how like you're saying with traditional Chinese medicine, they give you herbs, but you also probably need to be relaxed, and you need to calm your mind, and you need to, be in a stress-free environment. With with our Western medicine, the concept is you just take the medicine and keep going. So with homeopathic medicine, do you have to be as centered and slow down and stress-free, or can you take the tinctures and keep moving?
No, you can take tinctures and keep moving. The whole idea is like you will be centered later on. Yes.
I see. Yes. So this is great. So basically, do you see whether homeopathic medicine is making a comeback? Are you seeing more people gaining traction with more physicians? What are you seeing in the field?
I'm actually seeing it more awareness among patients, because I think more patients are seeking complementary medicine. And among the top 3 complementary medicine, I think homeopathy is one of them the patients are seeking. And there are lots of physicians who are showing interest as far as integrative medicine is concerned. But still, we are long way from 19th century when most of the physicians were practicing homeopathy. And as I said, like there were homeopathic medical colleges also.
So you say the top 3 homeopathy, what are the other 2?
It's more of acupuncture and nutritional supplements, naturopath.
Okay. And of course, you practice acupuncture as well. So you've got 2 of those 3, and then nutritional supplements. Yeah, the supplement field is kind of a little bit wide open and crazy. We've discussed that.
Yes.
And perhaps we can kind of get into that later on. Do you use supplements, or you use homeopathic tinctures? Do you ever vitamins?
Yes, I use more of homeopathic medicines and traditional Chinese medicine. I may recommend supplements, but no, I don't go into that. No.
Gotcha. So basically, like the micronutrients and things you find can come from the herbs, which are basically, the herbs are food-based substances, as I understand. Is that correct? Or
yes, some of them are food-based, some of them are medicinal plants.
Okay. Gotcha. Well, that's fascinating. The thing is that I'm hoping that it does make a comeback. And, I've just gotten into the space of, looking outside of Western medicine. My background and training, as you know, is very strongly Western medicine with the specialty, subspecialty, subspecialty. And then, I was introduced to this field by just realizing if people just ate better, they got better. And I said, well, wait a minute, there must be more to that. And so one thing led to another. But it's been pretty clear to me, someone who's well trained into the Western medical approach, that these alternative approaches in many cases are better. And I see patients who are very acutely ill, and we do things with their nutrition and so on. Clearly if someone, is in a cardiac arrest, you do CPR and
right.
You do acute things, but once they're stable, even in the unstable setting, we apply nutritional therapies on these patients, and we find that they do quite well, because it's, if I have somebody on a milrinone pump or some other vasoactive drug, I can also put them on a nutritional detox. And I find that has a favorable impact on these patients, and even in the acute setting. So we often think that, these therapies have to wait, but we've seen that even someone who has some active disease can benefit from it. So it's an amazing thing. What I'd like to do is take a quick break here, and the next part 2, I want to get into who benefits from homeopathic medicine and some of the details there. So I look forward to getting into some of those issues. So everybody stay tuned. We're going to go to part 2. We're going to talk about homeopathic medicine, who benefits, what are some of the issues that you address on a day-to-day basis. Okay, we're back here with our panel. So, we have a number of questions in the chat. I'm going to bring them on. But, Dr. Shaw, what's a typical patient who benefits from homeopathic medicine? or maybe it's easier to say who doesn't benefit, but what's the typical patient who benefit from homeopathic medicine?
So actually, like, I see different kinds of patients. Like, I see adults, I also see children. And unfortunately, right now, the practice is such, like, patients who don't get any relief from Western medicine, they tend to seek homeopathic treatment. Unless the patients are from some other countries, like if someone is from Mexico or Argentina or Australia, they immediately seek homeopathic medicine as a
Gotcha. So basically, most of your people are people who fail the Western medicine, so you tend to get the most difficult patients.
Yes.
I have a quick question, Dr. Shaw. Also,
Yes.
so I remember in talking to somebody in Chinese traditional medicine, they actually said that in their culture, they go to their practitioner when they're well. So
Yes.
that way they don't really have to go to the doctor technically when they're sick. So is that the same kind of concept with homeopathy? Should we all be starting to think about and do some of the things to keep the cells functioning in an ideal fashion now before we get depletion? Or, how does that work?
No, with homeopathy, like, I prefer, as long as you have good diet and you have a good lifestyle, it's already taken care of. But I would prefer it as the first line of treatment instead of seeking, for example, I see children with ear infections. I see children with eczema. I'm also seeing adults with anxiety. Lots of patients are coming for GERD, irritable bowel syndrome. So before with the conventional medicine, I always tell them, like, change in the lifestyle and more of holistic approach. You should go with that, where we are not dealing with any of the side effects, and the healing process is much better because it is actually helping your own body's healing system to whole process of dealing with the disease.
So you like starting with the foundation,
yes,
diet and exercise, and then optimal nutrition and what have you.
Yes.
Now, you mentioned GERD, IBS. How about patients with hormone problems or arthritis, inflammation, hypertension, cancer, diabetes, heart failure, heart attacks? Have you had any of those patients with those histories come in for your care?
So I'm seeing lots of patients with autoimmune disorders. So I'm seeing lots of lupus, I'm seeing rheumatoid arthritis, Sjogren's disease. And homeopathy has really helped them with autoimmune disorders. I'm also seeing lots of cases of hormonal imbalance, whether it is like PCOS or women going through perimenopause. I'm also seeing thyroid issues like Hashimoto's. Hypertension also, now with the patients who have gone through cardiac surgery, they tend to come after the surgery for the healing and kind of like to help with the recovery and kind of balancing the whole mind and body. So I end up seeing patients after that, yes.
Gotcha. Diabetes, cancer, any of those other issues?
So diabetes, I see. Cancer, it is more of like supplemental therapy. Like, I help them more depending on what stage it is, like whether it is palliative, or in case of cancer, more of like holistic approach to help more with their mind and body.
Gotcha. So with homeopathic medicine, and let me just throw a couple of questions here. Catherine Welch, would you describe some breakthroughs, cures as a result of incorporating homeopathy? Any general breakthroughs? In part 3, we're going to get through some, and I'll ask you to discuss some of your interesting patients. But in general, any breakthroughs at homeopathy that you are cures, or that word cure is kind of
that's
strange.
misleading. Yes,
it's different meanings of cure. It's sort of like if your tire's crooked, you straighten it up. Did you cure it? No, you just straighten it up. I don't know. But anyway, how would you address that question? Any breakthrough?
Okay, so especially with children who have frequent ear infections. So I have been able to help children, like, where they don't have to be continuously on antibiotics. With homeopathy, we have been able to kind of stop that, and they don't have any ear infections. Lots of cases of PCOS, polycystic ovarian disease, where they have to be on birth control pills. Once they stop that, they don't have regular cycles. They have not been able to conceive. Homeopathy has helped in such patients where they are not on any of the hormonal treatment. Just with homeopathy, we have been able to kind of resolve that. And with autoimmune, many of them are into remission just with homeopathy.
Wow, wow. So basically these underlying conditions, I guess you're addressing the underlying inflammation and that type of thing with the homeopathic treatment approach. Wow.
Yes.
So everybody who just may be joining in, hello, Nicole, hello, Cynthia Hammett. We're talking about homeopathic medicine. What is homeopathic medicine? We have a special guest here, Dr. Sakita Shah, who's giving us insight. She has a background training in traditional Western medicine, as well as homeopathy, as well as Chinese medicine and acupuncture. And she'll be sharing some insights in all of those areas. And what we're getting insight into now is homeopathy and what type of patients benefit from homeopathic medicine. And so we have a number of questions. Cynthia Hammett actually mentioned that she used to go see a homeopathic doctor on Federal Road. Is that the doctor that you may have mentioned? I don't know, the doctor who just retired. Maybe he was on that street. I don't know. Cynthia also wants to know about holistic medicine. Now, I think you did touch base on this. Is when people say holistic medicine versus homeopathic, I mean, how would you differentiate those two?
Actually, it's the same thing, because homeopathy is considered holistic medicine.
Really?
Because we take into account mind-body connection, and the patient as a whole is treated, not just like the patient is coming to see me for asthma and I'm just going to address asthma. No, I'm going to address asthma, anxiety, sleep issues, if the patient has any digestive issues. So the whole approach is holistic, like you are treating the person, not just the disease.
Gotcha. So basically, let's say you have a patient, maybe it's a young 25-year-old, they exercise, they're fit, they eat a quote unquote healthy diet, and maybe they have allergies, or they have, maybe it's a female with not PCOS, but, hormone imbalances, or maybe it's a male that has some hypertension or some chronic illness. How do you address that? So that person in theory is, healthy, so they're not eating a lot of trash. Maybe they're vegans. Let's say they're healthy vegans. Not that everybody thinks that's the best diet, but anyway. So what would be some explanations as to what's going on with a patient like that? Young, relatively healthy, eating healthy, exercising, seemingly doing everything right. What would be some of the things that you would think of that they're missing?
So usually, like, it indicates there is some imbalance going on where the body itself is not able to heal itself or correct itself. And interestingly, like, since you mentioned hypertension, like, I have also seen lots of psychosomatic illnesses where there is some trigger, some stimuli. The person just suddenly lost a job, or I'm seeing lots of cases now with this pandemic. So there is some mental stress, mental trauma, which kind of led to physical condition. And when the patient comes to see us, like, we tend to take the history in detail, like it's almost hour and a half long. Not only I'll be talking about the physical condition, but about the lifestyle, about like what have they gone through, any emotional or physical stress in the past, when did they start, how was the lifestyle before that. So we tend to address all those issues, and then a picture is formed where the imbalance is going on, and then we try to match that patient's picture with a specific medicine, which is more kind of like individualized, keeping the patient's all the signs and symptoms in mind, and that particular medicine is given to the patient for the treatment.
So if someone has a particular somatic issue, or maybe they're stressed about the pandemic, or maybe there was some life issue they dealt with. I mean, like the hypothetical 25-year-old,
right.
Maybe there was some issue in high school or whatever that you pick up in the history. With those psychosocial issues, maybe it's a traumatic issue that's having an emotional impact. Is there a medicine that you would choose to sort of help counter that?
Yes. Absolutely. Yes, because that started the whole cycle. Like that was the stimuli, that was a trigger which kind of offset, which kind of changed the whole balance, which was kind of more in homeopathy, we talk about vital force, which is your internal force, your vitality. So whenever there is any trigger which upsets that vital force, you may have signs and symptoms at different levels. You may develop a physical ailment, as you mentioned, hypertension or arthritis, or you may have some mental ailment, kind of like anxiety, panic attacks. So all this is triggered by some stimuli usually. In some cases, we may not find the stimuli, but when we take the case, we do take into account that particular stimuli because we need to address that. Something changed that caused the whole cycle of events after that stressful period.
Gotcha. So the stressful period, even though it was an environmental, a psychosocial thing, you can identify certain stressful stimuli that can have a physiological effect. And so then you treat that physiological effect with some herb or substance. Do I have that correct?
Absolutely. Absolutely. So it does play a role. It does play a role because I remember some 15 years back, I ended up seeing lots of cases of fibromyalgia. And at that time, fibromyalgia was not diagnosed as fibromyalgia. Those women were put on anti-anxiety, antidepressant medication, and they were still suffering. I mean, I'm talking about 15, 20 years back. But it was interesting with many of them, like there were some trauma or like they had difficult labor or they had some stressful family situation. And soon after that, they started developing all the signs and symptoms of fibromyalgia. Some of them also had chronic fatigue along with that. So when we prescribe the medicine, you do take into account all those factors which led to it.
Gotcha. How long does it take you to see an effect? So when you start them on the homeopathic medicine, is it like a week or a month, or when do you start to see an effect?
So usually I like to see some changes within 2 weeks' time if I'm dealing with a chronic case.
Okay.
Within 2 weeks to at least a month. And I do a follow-up after a month when we go over all the signs and symptoms again. Because as I said, like it's a holistic approach. So I ask them questions regarding their appetite, their sleep, their menstrual cycle, or even like if they have any other health issues. So it's a detailed intake after the first visit to go over whether I'm seeing changes in any of the areas. And depending on that, I may change the dosage of the medicine or I might have to change the medicine completely if I don't see changes. But again, I'm talking about chronic cases. In acute case, you have to start seeing changes immediately within a day or so.
Gotcha. Cynthia has talked about the experience she had. She took her daughter to a homeopathic doctor for ulcerative colitis, but her daughter didn't want to swallow the supplement pills. Are those pills large or small or what?
Oh, no, they are very tiny. I wish I could show the picture. Like they are kind of like sugar pills, so they are sublingual. So they just dissolve on the tip of the tongue. And lots of times with children, I also give them in water. So it doesn't have any taste. It just tastes like water and children love it.
So you can just dissolve it.
Mm-hmm. It's sublingual. Yes.
Wow. So Faye Parker, she missed the first half, but she has an interesting question. So is homeopathy similar to a vaccine in the sense that you expose the immune system to a small amount of the culprit or the healing agent?
It's interesting. Yeah. When you use it more generalized, the principle is very similar to vaccine. But the difference being like in vaccine, we are using a specific virus or specific ailment. Whereas in homeopathy, we are not going to use the same substance. We are going to use something which is similar to that.
Okay. So you use something that's molecularly similar, but it's working on more than just the immune system. It's probably working on other components.
And like, just to give you one example, like for example, when you drink coffee, like people who drink coffee, like they may have insomnia, they have sleep issues, or they may have palpitations, or they become more edgy, irritated, or they might have headaches. So there is a medicine which is prepared from coffee called as coffee akruda. So lots of times we use this medicine for the treatment of headaches, treatment of insomnia, treatment of palpitation. So it is something similar, but not necessarily it's the same substance which started the whole process.
What's the name of that again?
Coffea cruda.
For Coffea cruda. How do I spell it?
It's prepared from coffee. It's COFFEA. It's prepared from coffee.
Okay.
And there is also, yes.
Are the supplements usually plant-based or not necessarily?
Not necessarily. Some are plant-based, some are prepared from the minerals. Like we have medicine which is prepared from calcium carbonate.
Okay.
But all the medicines are
animals.
Some of them are prepared. Yeah, there are some toxic substances, like some are prepared from poison.
Okay.
Oh, wow. But if you have someone who's plant-based who didn't want to take something plant-based, you have alternatives, I guess, right?
Yes, we have alternatives. And again, these are highly, highly diluted, where you don't even see the actual material dose of the medicine itself. They're highly diluted and potentized. That's why it is also called as energy medicine, or some people call it placebo. Lots of physicians like to call it placebo because they feel there is nothing in there.
Well, you're getting results, so it's got to be more than just nothing that's in there. What, and last part of this part two, what are the risks? I mean, what are the potential adverse effects of somebody coming and getting homeopathic medicine treatment?
Usually there is no adverse effect because as a practitioner, you know how the medicines interact with each other. Plus, these medicines are highly diluted and potentized, so they can be used by pregnant women, they can be taken by newborn, you can combine it with conventional medicine. So that way, there is no side effects as such when we talk about homeopathy. But when it goes into the hands of lay practitioner, then I feel it changes because they don't know what disease they are treating, they have limited knowledge of the disease itself, and that can lead to problem, I feel.
Yeah, and one thing I want to point out to people just checking in, I mean, as you mentioned at the outset, you go through 5 to 6 years of training in homeopathic medicine. That's in addition to your traditional medicine. So, I mean, there's a lot of insight that you have to gain and a lot of experience that you gain, and then you go into residencies as well. So I didn't know the training was that extensive. And so that's quite a bit of training that you go through. So there must be a lot to it. Compared to naturopathic doctors, they get maybe a topic in it, but they don't have as much training. So if a naturopathic doctor was using homeopathic treatments, I guess that's when there's a chance of something going awry. Is that what or would they go only so far and then refer them to a naturopathic doctor if they need to, a homeopathic doctor if they need it?
I think they would refer them, I feel. They would refer them. I'm more concerned about some people practicing at home, or, like I see that there are lots of people who like to just pick up homeopathic medicines from health food stores and self-medicate. I think that's when yeah.
So these homeopathic medicines and things, they're just available over the counter, some of them?
Some of them, yes.
Wow, I wasn't aware of that. That's so that could be pretty dangerous. So interesting. I'm glad you pointed that out. So this is something that you wouldn't want to do at home necessarily. So that's something for our guests to remember. So as we get ready, I'd like to get into part 3. And Dr. Shah, in part 3, what I'd like to do, I want to get into the nuances of your practice. You have other specialties. I'd like for you to talk a little bit about some of the other things that you do. How do you integrate those things? And I'd like to hear some of your success stories. Tell us about some of the patients that you've treated, some, gee whiz stories. So everybody hang on. We're going to take a little break here, and we'll come back to part 3 and get inside Dr. Shah's practice. Okay, we're back and we're here with Dr. Shah. And so, we're going to get into some of the nuances of her practice. As those of you just checking in, Dr. Shaw is a physician here in the Houston area. She's trained in Western medicine, as well as homeopathic medicine, as well as acupuncture and Chinese herbal medicine. So she brings all of these insights together. She treats a lot of patients with adults and children with diseases ranging from hypertension, heart disease, individuals with post-op surgical patients, many patients with autoimmune disease. She treats patients with GERD, inflammatory bowel disease, children with eczema, ear infections, patients with diabetes, cancer, and the like. So she really covered a broad spectrum of people with chronic diseases. And so, Dr. Shaw, I would like to get into your practice. So you have someone coming in and we'll call them the typical train wreck. They've got, high blood pressure, diabetes, they have irritable bowel disease, autoimmune disease, and you start to evaluate them. Of course, as you said before, you get a detailed history. How do you integrate the different parts of your practice? Tell us about your practice in general, and how do you integrate those things, and give us some examples of that.
So usually, as far as children are concerned, I like to treat them with homeopathy for children. I prefer that. And with adults, it can be homeopathy or acupuncture or traditional Chinese medicine. Most of the time when the patients call to make an appointment, they have certain modality in mind. Very rarely I come across patients where they will leave it up to me, like what I would like to go with. Usually they'll say, oh, I'm here for homeopathy, or I'm here for acupuncture or traditional Chinese medicine. And in the practice, I like to start with one. I usually don't combine all the three modalities together, because it's very difficult to judge or assess what is helping them, whether it was homeopathy which is helping them, or whether it is traditional Chinese medicine or acupuncture. So I like to start with one, and then I may switch to the other modality instead of combining everything at the same time.
Gotcha. So basically, let's say somebody comes in with real bad, let's say they have diabetes, high blood pressure, and autoimmune disease, and they'll come and say, look, I'd like to have Chinese medicine. You would start with that, or would you say, hey, I think homeopathy could help you better? Or do you know which could help better from the onset?
So with some cases, I'll start with one. Like, for example, with autoimmune disorders, lots of times I like to start with homeopathy. And good thing about homeopathy is, like, it can be combined with conventional medicine. So even, for example, pregnant women, if they come to see me for sinus infection, I'll go with homeopathy instead of going with traditional Chinese medicine. Or same thing with children. But there are certain cases where both modalities are very useful and very helpful. Then I'll leave it up to the patient. Or I might decide, depending on the patient's age, or if I feel they will be willing to take homeopathic medicine or traditional Chinese medicine, what they are comfortable with. Then I may decide on that. And there are some cases where I feel one is more beneficial than the other. Then I might suggest that.
Gotcha. Okay. That's fascinating. So now someone asked a question about the tinctures. Do you mix the tinctures yourself? Are there situations where you have to mix the tinctures, or how does that work?
Sometimes we do that. Sometimes we mix the tinctures, but usually in homeopathy, we just go with one medicine at a time. The whole idea is usually just single medicine at a time. So usually we don't combine tinctures. We just pick only one that is suited to that particular individual. So it's very customized medicine. Gotcha.
Can you give us some examples of patients, some really difficult patients, challenging patients that you've had, and share with us how you've worked through some of their situations?
So I had a child some few years back who had behavior issue, and the child was kind of biting other kids. Even like behavior used to be a problem with the family members. And the child also had frequent ear infections. So actually they brought the child for the ear infection. And I started treating that child with homeopathy. And it was interesting that the parents were quite surprised. Not only the frequency of ear infections went down, but the behavior of the child started to improve. but the child became much more manageable. The biting, the behavior issues toned down a lot, and as well as the physical complaints started getting better too. So it's like the more of a holistic approach. Not only you are treating the physical complaint, but the patient should start feeling better overall.
What would you say?
And quick question, in that case, like, do you just give them a tincture, for example, or are you saying, okay, he needs to go to sleep at 9 o'clock, he needs to have this for breakfast? Do you have to give them that much detail, or are you just saying, take this tincture?
So that may vary. It depends on the parents and the child. On the first visit, I just go with the medicine itself.
Okay.
And once they feel like, okay, it is helping, then they are more receptive to it. Then I may start adding other things to that too.
Okay.
Yes.
So in that example you gave, what would you say is a common underlying process behavior? I mean, there's some kind of a chemical imbalance, but
yes,
as I would see it, is that a trigger for the kid's life, or what the kid's eating, or how?
Oh, yes, absolutely. What the kid is eating. Lots of times I see that even the mother, if she had difficult pregnancy, that tends to affect the child too. So when I take the detailed history and intake, I do ask about mother's state of mind, mother's physical health during pregnancy, because it is very interesting to see, like, it does reflect on the child.
So you can get results with your tinctures. So the kid's, he's eating junk foods, he comes in and he has these problems. You can start a tincture that can kind of counter the adverse effects of the lifestyle, the bad food, etc., to give him some preliminary results. Is that?
Yes, but it's just the preliminary results. So you still need to work on the diet. Absolutely. Yes.
Gotcha. Well, that's actually quite good, because, I mean, as you alluded to before, when they start to get some results, then you add the other things. Okay, now you need to start eating healthier, etc. I mean, my situation, okay, cut out the junk, and we're going to put you on a raw detox, and that becomes quite an ordeal. But that's a nice type of intervention that you have to get something to counter those things in a natural way, and then they get some benefit, and then you start to add the other lifestyle things.
Right. Yeah.
Any interesting cases with adults with chronic ailments that you can share with us?
So I had a case of lupus many years back, and that patient still comes like anytime she has any health issues. And she was taking conventional treatment that time, but she wanted to switch to alternative medicine, and she was aware about homeopathy. So she came to see me. And I remember, I took her detailed case and everything and prescribed the homeopathic medicine for her, but her primary care physician was not open to that. So I told her, what I would like you to do is, I would like you to get all the blood work. Let's get all the ANA titer, and we will just monitor it. Let's get the blood work repeated again after 3 months to see what kind of changes we are noticing. Because I took her detailed history regarding her physical ailment, her mental symptoms, and everything. And every 3 to 6 months, we were getting her blood work done to see that we want to see changes at the lab work and with the antibody titer also. And it started going down. And I remember her ANA titer was I don't remember, 400 and something, and it came down.
Wow.
So, and she is in remission. So that was a very interesting case, because she had to talk to her medical physician who was not open to it. So we had to prove that this is helping, this is working through blood work, because just the symptoms were not enough. We had to show some proof that actually homeopathy is helping her.
So basically, with the homeopathic medicine, she was getting better. The labs, the NA titer improved. So you showed the chemical results and changes were getting better. And was she able to come off some of her other Western medications?
Oh, yes, absolutely. Yes, she was able to completely come off of it. Absolutely.
Wow. What was the response of her primary care physician? Do you know, or did you get feedback?
I think he was quite surprised, but still he was not open to it, unfortunately.
I've heard that before. I've heard that before. You know, this is
and that reminds me, like I had a case of a patient. She used to actually come for acupuncture treatment for her arthritis.
Mm-hmm.
And she had a fall and she fractured her radius and ulna. Like she had a bad fracture. It was a compound fracture. She went through the surgery.
Wow.
And after that, her fracture was not healing. And they were kind of concerned about it. And they suggested like maybe she needs to go and see a specialist. They were not sure what was happening. They recommended some specific, I don't remember, like they had recommended some kind of machine which helps with the healing of bone, but like just 40%, and the insurance wouldn't cover it. So she had to pay like $2,000 just to kind of get it and try it. And she talked to me about it. And I said, if you're open to homeopathy, there is a very wonderful homeopathic medicine for healing of bones, for fractures. Like, why don't you take it? And we can get the X-ray repeated after 3 weeks to see if there is any change or not. So she started taking that medicine. And I think we repeated the X-ray after a month. And the healing was taking place. Like it was better by almost 30 to 40%.
Wow.
And she continued taking it for 1 more month and it was completely healed. But unfortunately, the orthopedic surgeon never asked her what she did and how the fracture healed finally. So we were waiting that he will ask and we can tell them that homeopathic medicine helped with the fracture.
Yeah, there's unfortunately, our colleagues have very little curiosity in terms of how the patients are getting better, unless it's, you know, some pill or procedure. Yeah, it's quite interesting. That story is great because I know of at least one patient who definitely needs to get your services. So I'll definitely refer. There's somebody off the top of my head I know, but I think there's several patients who would benefit. As we start to get toward the end, can you tell us a little bit about, I may have to bring you back and ask you to talk about acupuncture, but tell us about your acupuncture practice real quick, and what are some of the health conditions you treat with acupuncture?
So with acupuncture also, I treat all different conditions. Like I see lots of patients with pain, lots of cases of arthritis, lots of cases of degenerative disc disorder. Nowadays, I'm seeing many cases of allergies because Houston is a prime hub for allergies, unfortunately. So I end up seeing cases of allergies in fall and spring. And recently, I'm seeing cases of anxiety and depression who are seeking acupuncture treatment because they would like to get off of some of their medication.
And acupuncture helps with anxiety and depression?
Yes.
Wow. I'll definitely have to keep that in mind. You know, this has been a great. Any other questions, Dr. Palmer?
No, it's just I actually had a patient who was getting, it's a teenager who was getting acupuncture for her anxiety.
Yes.
Through the hospital, actually. So some of the interesting thing is some of the hospitals are starting to incorporate acupuncture into our Western medicine as a alternative, because some of the pain medicines, especially with children, we don't want to go so high. So that is a modality that we use also in our Western medicine.
That's wonderful.
I don't know if it's covered by insurance though, but I know I've heard a patient saying that they're getting it through the hospital.
Yeah, one question related to insurance. Ms. Yolanda Williams wants to know, is it covered by Medicare and Medicaid?
Unfortunately not.
Yeah.
Yeah, and that's the sad part. Like even insurance in state of Texas, it's not covered. I think the only state I know is California, which covers homeopathy.
Really? Oh, wow. Okay. Well, you know, I'm a believer that if you really want to invest in your health, I mean, I know, you know, everybody doesn't have a ton of money, but you know, even in the Western medical, and I see patients with insurance all the time, and they come in and they're having their co-pays and deductibles and things like that. They're 20% and what have you. They're paying quite a bit of money out of pocket, even with insurance. And so, we think that the insurance part is, just because the insurance company is covering it, the insurance company oftentimes put a huge burden on someone. So if you need a certain, like you mentioned, the patient needed some special surgical therapy, they were going to have to pay 40%, which is some 40% of some large dollar amount.
Right.
So oftentimes patients with hospitalizations and all of these things, you say, well, I'm going to go through my traditional medical therapy. So then you're paying for all the prescription drugs. Then you have to have this procedure and this hospitalization. Then you have a complication and you're going into the emergency room from time to time. And so once you've paid all these co-pays and deductibles and all of this money, you could have, gone to someone and got on a nutritional plan or homeopathic doctor, get on some tinctures and things. And if you take care of it, your body holistically, you're really going to save money. So,
Oh, yes.
People think they're saving by using the insurance. You pay a high premium, you pay a high deductible, you pay a high copay, you pay a high, 20%. And yet you are going through this whole process of, pills and procedures, and you're not necessarily getting better. And so you come to, use a holistic approach. It cuts to the course of things. And I don't know. I think that people can save money. So what are your thoughts on that?
Oh, absolutely. On a long-term basis, it turns out to be much more reasonable and much more cheaper compared to going through conventional. Absolutely.
Yeah. So Mr. Thrifty Tex is going to get his wife to you. So for everybody, you can reach Dr. Shaw. The website to her center is on the scroll. It's altherapiescenter.com. That's ALTTHERAPIESCENTER.com. altherapiescenter.com. It's on the scroll there. Dr. Shaw, I'm going to let you have the last word. So what are your comments, our audience in general? They have ailments and different things. How should they take this information and what should they do with it? What are your final words on that?
So with complementary medicine, it has a lot to offer where we are dealing with human body and helping your own body to heal itself. So this is not something which you will be on it lifelong. The whole idea is to kind of give you the support. And once your body starts healing itself, that support is taken out because you don't need it. And the difference is, like when you take natural medicine, the overall sense of well-being is there, which you don't see with conventional medicine. That's a very big difference I always see. And I always tell patients, like, all these therapies have been around for so many years. So at least try that. If you don't see response or if you don't see results, there is always Western medicine to fall back on. But don't go with that because you are putting all those different chemicals in your body, which has its own side effects. Especially with natural treatment, natural medicine, you are dealing it more on a natural way, where you are not dealing with any side effects. And there is that overall sense of well-being. You will see a difference, both on mental and physical level.
Wow. That's a great final word. And again, I've learned a lot. I've got, a huge page of notes here. And so this is going to be very helpful. Dr. Shaw, thank you very much. I'd like to, in advance, invite you to come back and talk about acupuncture in more detail. And maybe we need to do a third part with Western herbal, Chinese herbal medicine as well. So a great amount of information, and I'm sure our audience has gotten good information. I want to see the two of you backstage as I close out. Thank you very much. I look forward to seeing you in the distant future. So again, another show where I've learned a lot, and I hope that you've gotten a lot out of this show. And of course, if you did, hit the like button, the thumbs up. That helps the YouTube algorithm send more people this way. Also, subscribe if you haven't, and share this information with as many people as you can. I think this is very valuable information. In my practice, I see a lot of people who are looking for alternative approaches, and I'm certainly going to refer them to Dr. Shaw regarding some of the things that she can offer. But again, share this information. with friends and loved ones, I'm sure they're going to benefit from it. And of course, as always, until we see you next Monday, we'll be talking about attention deficit disorder next Monday with Dr. Palmer. And until then, keep it fresh, natural, and live.